the more you start learning is like your outrage meter starts ticking up, and you're like, what?
Yes.
What? How is this? How is this the way it is? Why are we the way we are? In terms of, the unregulated chemicals in the marketplace and the poor regulation and the dismissal by a lot of the medical community, the dismissal by a lot of general people in the world that don't think this is a problem. It's that outrage meter is part of what fuels me to keep sharing this information, because it's not okay.
Yeah. And I think that which you cannot, if you do not measure it, how can you manage it? Right. And it's this idea that if you're not even looking for it, if you don't even think that it's a reality, then, it's very similar to when back in the day when, they proposed the idea of germs, and it was like, yeah, there's these like little bugs that like, that's why we have to wash our hands before surgery. And people thought that you were barking mad if you wanted to wash your hands before surgery, because it's like, well, what are you talking about? These little things on your hands that we can't see.
Can't see, right?
Right, exactly.
Well, and it's also, as I love to say, the sort of famous, I don't know if it's famous, but, the absence of evidence is not evidence of absence, right?
Correct.
Which we say, like, if we don't have data to show that something is safe, that doesn't or something that should, we don't have data that proves something is harmful, that doesn't by definition mean that it's safe. It just means that we don't have the data.
Right.
But there's a lot of really big cognitive leaps that people make in the absence of evidence.
I completely agree with that. And I also would say that oftentimes the clinical practice, like what is accepted as evidence-based in the clinical world, often lags by 20 years versus what we're seeing in the research. So that's actually paralleling exactly what you're saying, where you, at the time, like 10, 12 years ago, you're like, look at the mountain of evidence around some of these toxicants, and no one, whether it's a practitioner or otherwise, a clinician has no idea that this is even a possibility that they're bringing into their care with their patients.
Right. And, when we look at sort of some of why that is, first of all, like, okay, medical school is really long, right? It's already long. So there's only so much stuff that you can jam in. That's why it's called a practice, right? You constantly learning, like, you don't just like know everything the moment you graduate. It's just really the beginning. But, of the medical school curriculums out there that offer training in environmental health or environmental medicine, the average number of hours is only 7, right? And that's if the program offers it. The average number of hours is 7. And that is woefully inadequate, considering that we are ubiquitously exposed. We're all exposed. Some of these toxicants are present in 98, 99% of the U.S. population, global population, and so not looking at these real life scenarios of exposure, these chronic low dose exposures as part of that curriculum, it's not there yet. That curriculum is still looking at occupational exposures, drug use, cigarette smoking, alcohol abuse, and they're looking at it often through that lens, not through this lens of, hey, the personal care products and consumer goods. And so that education that exists is also lacking. And there was a survey, I think this was done in 2013 maybe, of medical students on this topic of environmental health. And they basically said, we feel woefully inadequate in this area. Like, we just don't have the training. Same with nurse practitioners. They just don't have the training. And yet, there are environmental medicine doctors in this field that really, kind of hang their hat on this understanding that toxicity is the primary driver of disease. Dr. Joseph Pizzorno, founder of Bastyr University, leader in this environmental medicine space, like he sticks his flag in that toxins are really underlying all chronic disease to some degree, and it's partly because we're all being exposed.